Well, hello and welcome everyone to this Wednesday Facebook Live. I am here in the group to answer any questions that you may have going on with Medicare. As many of you know, I recently got back from Washington, D.C., where we heard lots and lots of information about the Inflation Reduction Act, and we're watching that closely. We still don't know for sure what we may be looking at for this fall. We heard some estimates of Part D premium increases in the neighborhood of 20%, and maybe some carriers that won't continue with Part D. So we are watching that situation really closely for you, and we'll report as we get more information that comes along. So let me see here. I'm going to hop on over to some of the questions that came in this week, and then if you have a question while I'm here live, by all means, just drop it in the comments below and I will answer it before we finish up today's call. So one question that I spotted in the group this week that I specifically want to go over is about the idea of employer creditable coverage, the large employer and small employer. So if you're still working at age 65 and you work for a large employer of 20 or more employees, then your Medicare is going to be secondary to that group insurance. So in that scenario, most people will enroll in Medicare Part A since Part A doesn't cost anything and it can coordinate with your employer coverage to reduce your expenditures in the event of an inpatient hospital stay. Now, later, when you get ready to retire, you will reach out to us 1 to 2 months before you're getting ready to retire, have that retirement date, and we will get you an application for Part B and an employer verification coverage sheet that you fill out, and we send an upload to Social Security so that you can add your Parts B and D at that time. Now, in my book, I cover some additional information about making sure how you store that credible coverage information so that you don't end up with a Part D late penalty. So I won't get into a whole bunch about that today, but you can find that in Chapter 5. One thing I did want to talk about though is when you work for a small employer. So in the group, someone posted, my small employer does not mandate Medicare at 65 and allows us the option to stay on the group plan at the full rate. And I've been looking for concrete answers. Do you have a solid answer on what are the questions I really need to be looking at? Is it a fact that all policies written for small less than 20 are not allowed to be written as creditable coverage? So the facts are, any type of employer coverage should serve as creditable coverage for not signing up for Medicare Parts A and B themselves at 65. And the key word there is should. So if you have a small employer, that insurance company can decide whether or not it will pay for your Part B. So if you are supposed to have Medicare Part A and B as primary coverage and employer coverage is your secondary coverage, and you just never sign up for the Parts A and B, when you have a claim that comes into that insurance company, the insurance company could choose to pay as if you had Part B or not pay. And we have seen the not pay situation a number of times. This is how people end up with a $20,000 bill because they needed an outpatient surgery and they never signed up for Part B. And so the small employer insurance company is looking for any way to get out of paying for that surgery. And they'll say, oh, well, we're secondary. You know, we're only going to pay 20% and we'll only pay our 20% after we have proof that Medicare paid the 80%, except you never signed up for Medicare and now you're stuck with the 80% of that bill. This is a real thing that happens out there. So in my opinion, for me, for my family members that I have advised on Medicare over the years, I tell them to get A and B when they're 65. Now, the second question is, will Social Security hit you with a late penalty for Part B in a small employer scenario? And the answer is they shouldn't, but we have run into dozens and dozens of people who get penalties for this. When Social Security reviews it and says, nope, you should have signed up at age 65. And then what happens is the beneficiary, you have to fight your way up the chain at Social Security until you get a person who knows what they're doing, because there's high turnover at Social Security. And so we see this all the time where someone gets stuck with a penalty that they shouldn't owe. They had small employer coverage since they were 65, but they have to go and fight that. And at that point, you aren't our client. We haven't worked with you yet. And so we can't even call Social Security on your behalf to argue it. It's going to be on your plate to do that. Now, will you be able to fight your way through and eventually get it fixed? Probably yes, you probably will. We've seen people do it. But I have also had specifically remember a guy that called here years ago, and he was age 72, and he was paying a 70% Part B penalty. And we were like, oh no, you need to work your way up at Social Security. And he was like, believe me, I tried. He's like, I have talked to everyone and nobody will take this penalty away from me. He was like, I was told wrong information about it when I was 65. I was told that it wouldn't be a problem. And then later, now it is a problem. So that is why in my book, I recommend that you should sign up for A and B at age 65 if you have small employer coverage. But the answers are you shouldn't have a penalty, and your small group employer, it's up to them whether or not they will pay as if you had Part B, and many of them will not. So you definitely don't count on what your employer is telling you. You need to speak to the insurance company itself who's providing those medical benefits to ask them, what happens if I don't have Medicare Part A and B and now I need a surgery? Are you guys going to pay the 80%? And I would get it in writing. So that's my best advice to you. And to me, it seems easier to sign up for Part B, but Part B gets more and more expensive every year. So I understand why people want to delay that whenever possible. We had another question came in about Medigap increases, and it said, my United Healthcare premium is increasing by $20 a month in June. I have seen other people in this group post the same comment. Are you seeing large increases for all Medigap companies this year, or is it just United Healthcare? So, it depends on the actual losses paid by the carrier in that year. So, no, it isn't that we're seeing big increases across the board. It's just the group of people being insured by United Healthcare versus the group of people being insured by Blue Cross Blue Shield are all going to have different health conditions that they're treating. And so if one carrier has some really heavy claims, then that increase for that year may be higher than another carrier who also insures a bunch of people but didn't have as much claims spending. So it's not a general trend in Medigap. It's just something that goes up or down. Now, we have seen some carriers will only do a rate increase once a year. United Healthcare is not one of those carriers. So we have seen sometimes where you'll have two small increases. So I don't know if that $20 will be the only one that you get. However, remember, United Healthcare discounts their rates when you come on at age 65. And so as that discount expires over the next 3 years to when you turn 68, you have not only the ordinary increase, but also the loss of that discount that sometimes makes United Healthcare seem more expensive up front. But they are good in terms of overall rates in the long run and sticking with them. If you want to be with one carrier forever, we have not seen excessive rate increases there. A question about Plan G that was similar. Why does it go up twice a year? And once at the first of the year and again in our birth month. So the one at the first of the year is probably your policy anniversary, assuming that you got your coverage in January, and then a birthday month as well. And we have seen that same thing with a few other carriers. So this is all just about the carrier itself. And if you are in decent health, then you could reach out to us and we could see about moving you to a carrier that we know only does an annual increase on a policy anniversary. You might be able to pass the underwriting, and it's a good idea to shop it if you think you can. I have a couple that have been with me. They've been with us for probably 15 years, and they're in good health, and they call every single year. We shop their policy every year, and if it's going to save them $5 a month, they switch. And if we add up all the years that they could have just eaten that small increase, by being so consistent and shopping it with us every year, I mean, those people have saved thousands and thousands of dollars in their premiums over the years. And that's you, Mervyn, Sandy, if you're watching. I'm complimenting the way that you keep in touch with us so we can shop rates for you and how well it has worked out. A question about straight Medicare with a supplement. Is it better than an Advantage plan? Okay, so I love this question because you guys are so funny when it comes to the arguments that happen in here about Medicare Advantage or Medigap. Man, there's some knockdown, drag out fights in here about that topic. And I always just want to say one is not considered to be better than the other because it depends on what matters to you. If the lowest premium possible is the most important thing because you have a very tight budget, then a Medicare Advantage plan, of course, is going to appeal to you. But if the most important thing is that you have access to any doctor or hospital in the United States because you have a health condition and you want to know if something serious happens and you need to go to the Mayo Clinic, you're going to be covered, then a Medigap plan is going to be probably feel like a better fit to you. So a lot of it has to do with what you expect. Now, we just come out with a series of videos on Medicare Advantage plans because when we produce Medigap content, we get comments on YouTube criticizing us for not covering Medicare Advantage and vice versa. When we're covering Medicare Advantage, I saw some posts here in the group about, I can't believe that Danielle is actually doing this. Well, the answer is because we have about 15% of our clients that have chosen Medicare Advantage, but they do it with a full explanation from my team about how exactly every single thing is going to work. And they go into their Medicare Advantage plan with no surprises. So the reason that we see, by and large, out there people who are unhappy with Advantage plans is because they called the 1-800 number because a sports celebrity told them to. And they got on the phone with someone, they had a 25-minute conversation, they enrolled without thinking, they didn't check if their doctors are in the network, they didn't check if their drugs are on the formulary, and now they're in a plan that they don't like. So there is some responsibility for you as the Medicare beneficiary, as the insurance consumer, to really learn about the plan that you're enrolling in. And what we often see is that people lean toward Medigap because of the freedom of access. But even if they can afford the Medigap, it's getting so hard to not do Medicare Advantage because we have inflation going on, rents have gone up, and this is just one bill, this Medigap policy that grows over time, especially if you have a health condition and then you can't switch. And we see people, they just feel like they don't have any other choice but to consider a Medicare Advantage plan. And we don't want it to be like that. We don't want them to feel like they're downgrading to substandard coverage. The coverage is designed to cover all of the same things that Medicare Part A and B covers. You just have a difference in accessing providers in the network. And like I always say in my webinars, when you are getting your health insurance from a company on a product that is designed to make a profit, you're going to run into prior authorizations. Now, Medicare has some of these as well, but they're not as strict, and you run into them more with a Medicare Advantage plan. That's just the nature of network insurance, whether you're on Medicare or whether you're 30 years old and you needed to have a prior authorization. Insurance just does that. Well, Medicare is just a big old rubber stamp, and they do a lot less prior authorization. They just approve almost everything, which is great as beneficiaries, but it's also bankrupting Medicare. And so they're trying to come to some balance around this. So you can't say that one is better. I will tell you that for my parents, and I talk about this as well in my book, my dad is a veteran, and he thought maybe he would get his care through the VA. I said, fine, you can do that, but we're also going to get you a Medicare supplement and a Part D drug plan because I know you, and you're going to go to that VA clinic with the best of intentions, and then you're going to wait 4 hours for your appointment, and you're not going to want to go back. And that is exactly what happened to my dad. So I put him on a Medigap plan because I want him to be able to go to whichever provider out there that he can, that he wants to, civilian or not, and be able to do that and then be able to fill those medications on the Part D plan. See? So super important to consider what's important to you. And for me, that was important. Like if it's my dad and he has a serious health condition, I don't want him to only have VA coverage. I want him to be able to go wherever he likes without a network. So that was more important to me than the low premiums. I'm in a position to be able to help my parents with some of these things. It might be different for you if you don't have that help from someone or you don't have an adequate budget for your health care, then you're going to look at alternatives, and that's exactly why Advantage plans were created in the first place. Question about working past 65. Do I still need to sign up for a specific plan? You do not. So if you have original Medicare Parts A and B, and that will coordinate with your group insurance, assuming that you're working for a large employer, you could delay enrollment into Parts B and D. The only reason that you would not sign up for Part A in that scenario would be if you're contributing to a health savings account. The IRS won't let you contribute to an HSA if you have any other form of insurance besides that employer high deductible plan. And so if that's the scenario, then you would delay both parts Medicare A and B. So most of you are working for large companies, and if that is your situation, we would recommend, as long as you don't have an HSA account, that you enroll in Part A and delay the Parts B and D. Another question we had was, my wife thinks she has to go to her primary doctor for a pap smear. She says Medicare won't cover it if she goes to a gynecologist. Is this correct? That is not correct. So she just has to have a physician that does them. So if her primary care doctor has been the one providing them, great. But if her gynecologist takes Medicare, then she can have those done there. I've never heard that that wouldn't be covered. Something along those lines to mention is keeping in mind that if that pap smear is done outside of your wellness visit, then your actual exam and services would be covered, but the office visit might be denied since Medicare only pays partially for this. So you always want to look at how often Medicare covers this, and once you're past 65, they will do that annual well woman exam every 2 years, and then I think on colonoscopies it's every 5 years. It might be 10. So we want to look at the preventive benefits and see how that works. So those are most of the questions that we had that came into us prior to today. I'm not seeing any others. Oh, we did have one question from Alan. I wanted to address that. He had put it in the comments below, and it said, do excess charges count toward the Plan G high deductible $2,800 maximum out of pocket? So excess charges do not count toward your Part B deductible, but if you have a high deductible Plan G, it will count toward the $2,800 deductible. Now, I asked our claims team, I have a team that's been with us for quite a while, and one of the supervisors down there, I asked her, have we ever run into this where we had somebody that had an excess charge and had a high deductible Plan G, and we've seen how that goes. And we don't actually have an example, and that's because so few people do the high deductible Plan G. It's just a tiny handful of people that do that. Most people like the fuller coverage, but of those that we've had, we've never run into somebody with an excess charge that has been a problem for it to create a claim for us. And so the way that we were trained and informed by the carriers is that yes, that excess charge does count toward the $2,800. So hopefully that answers it. Question just popped in here. Does United Healthcare Plan G have a disappearing discount for plans issued in Florida? Off the top of my head, I don't know, just because every carrier in every state will all have different rules, and that would be thousands that I would have to know out of my little brain. But we can have our team research that question. We can speak to some of the agents in my team that are licensed in Florida and see if they have run into that. I have not heard of that, but I haven't done personal production in over 10 years now. Most of what I'm doing is educating and working with people on basic Medicare stuff. So team, I know you're listening. Let's reach out to one of our Florida agents and see if that is a particular carrier that's doing that. She's mentioning UHC in this. So we'll find out for you, and we'll drop that information below your comment. Question came in from Bill. Do I need to sign up for Medicare if I want to work until 66? And since I'm working till 66, does my wife also need to sign up? So assuming, Bill, that you're carrying your wife on your employer group health insurance, and assuming that that is a large employer with more than 20 employees, both you and your wife could enroll in Part A. That costs $0 because you have the work history in the United States, and you could delay Parts B and D until you turn 66 and you have that retirement date coming up. So that is what most people will do. Again, though, if you have an HSA and you're contributing to that, you would also delay the Part A. You would just delay all of it. So a lot of times people will say, well, do I have to sign up for the Part A? Like, it just seems like a pain to do it now. Can I do it all later? Well, yes, you could. But if you don't have an HSA, then you could have that Part A in place costing you nothing, coordinating with Medicare. And we have seen it save people thousands of dollars in the event of a hospital stay, because we have people out there that might have a group plan with a $4,000 or $5,000 deductible. They go in the hospital, they're going to have all these expenditures, but Medicare's deductible is a lot lower. So Medicare pays the difference between its deductible, $1,632, and that $4,000 or $5,000 deductible they have at work. So that's why it would be a good idea to do that. Now, keeping in mind, if you work for a small employer, Medicare is primary, and we covered that earlier in the video where I'm explaining that my advice is to go ahead and sign up for A and B. Some people do risk it, and they risk that they may end up with unexpected medical bills, and you could do that. Do your research, talk to your carrier. But in most cases, if that coverage is primary, you want to go ahead and sign up for whatever is going to be your primary coverage. All right, I think that is a wrap on the questions, so we're going to go ahead and close it out for today. Thanks everybody for being here, and if you have additional questions, just keep dropping them in the comments and we will respond online. Take care. Bye-bye.